Hi everyone, my name is Ellie Chervenkova, and the science highlight I will be presenting on is does the ketogenic diet improve cognitive function in patients with GLUT1 deficiency syndrome? And this is a 6 to 17th month follow-up study. And here is an outline of the presentation. We're going to first go over some background information on GLUT1, the study, the results of the study, and then a summary and discussion section. Let's first define what GLUT1 deficiency is. As we learned in the carbohydrate metabolism chapter, we know that GLUT1 is a protein and it involves moving glucose from outside of the cell into the inside of the cell. It is also involved in moving glucose through the blood-brain barrier, providing glucose as the main source of energy for the brain. Individuals with a mutation in the SLC2A1 gene reduces or altogether eliminates the function of GLUT1. Babies born with the GLUT1 deficiency syndrome are born normal. They have a normal birth weight and normal head circumference, but as they begin to develop, the head circumference, the brain and the skull do not develop normally, and this is called microcephaly. Symptoms of the GLUT1 deficiency syndrome include a variety of neurological problems, such as stiffness, abnormal tensing of the muscles, difficulty coordinating movements, speech difficulties, episodes of confusion, muscle twitchings, and seizures. And this particularly happens when they go long periods without eating. So, for example, overnight. 90% of these kids have seizures, and they can outgrow the seizures through a strict ketogenic diet. And the purpose of the study is to investigate the effects of dietary treatments with the ketogenic diet on cognitive functions in patients with GLUT1-DS through various neurological assessments, starting with the 6-month period and then continuing the assessment to 17 months. The study was done at the National Center for Epilepsy in Norway. 6 patients were diagnosed with GLUT1-DS when their seizures began or when they expressed developmental delay with or without microcephaly or movement disorders. And the 6 patients went standardized neurophysiological assessments before the diet as well as after the diet was initiated. Their blood ketosis was measured daily for the first few weeks of the study and then weekly for the duration of the study. All 6 patients were treated with either the ketogenic diet or the modified Atkins diet, abbreviated MAD, with a 4-to-1 ratio of lipids to protein and carbohydrates. The effect of the diet was that there was a greater than 90% reduction in seizure frequencies in all patients. And after the diet was introduced, they were monitored for 17 months, and considerable improvements in several aspects of neuropsychological functionings were seen. And these included coordinating movements, speech, improvements in confusion, headaches, muscle twitchings, and a significant reduction in seizures, like mentioned in the previous slide. The Bayley scales of infant and toddler development measured and assessed the following 5 domains: cognitive, receptive and expressive language, motor, social, and emotional development. And the other tool used for assessment was the Wechsler's intelligence scales, measuring attention, speed of information processing, visual tracking, and control of impulse responding. So the next few slides are going to be the results of the study, and I'm not going to go into too much detail, but I just want to point out the age that the symptoms became present in all 6 patients were before the age of 1, and these are the ages of diagnosis, as well as their symptoms, their head circumference at the diagnosis, and then their blood glucose ratios. In patients 1, 2, 3, and 4 were either seizure-free within the first month on the diet or had a greater than 90% reduction in seizure frequencies. And patients 1, 2, 3, and 4 are children, and patients 5 and 6 are adults, but they did not have seizures prior to the diet. And these are the ratios of lipids to protein and carbohydrates in the patients. Patients 1, 2, 3, and 4 were put on a ketogenic diet, and then patients 5 and 6 had a modified Atkins diet. And here you can see the pre and post diet data for all 6 patients. After the 17 months of monitoring, there is significant improvement in language expressive and receptive skills, as well as speed of speech. And all 6 patients had an improvement or great improvement in all of the following 5 domains: alertness, language, social engagement, articulation, and physical endurance. The main findings of the study was that when the ketogenic diet or modified Atkins diet was introduced, all 6 patients with GLUT1 deficiency syndrome improved greatly, and especially their seizures within the first month of the diet either completely were gone or had a 90% reduction in the frequencies of how often they have the seizures. Something I just want to point out is that 5 to 10% of patients who were admitted at the National Center for Epilepsy in Norway did not have epilepsy. And the article mentioned that pediatricians have a difficulty diagnosing these patients because they don't have epilepsy, and they could incorrectly identify or even completely abandon the diagnosis, which has been a problem. Also, the study shows that the earlier the diagnosis is made and the earlier the diet intervention is put in place, the better, and the more improvement the patient has. Also, general IQ scores did not change in individuals who were diagnosed in late childhood or adulthood at the 6-month follow-up. So the conclusions that can be made from the study is the sooner the individual is diagnosed, the better. The ketogenic diet or the modified Atkins diet can significantly improve GLUT1 deficiency syndrome. In all 6 patients, there was significant improvement in neurological and motor function skills. The strengths of the study was that it was a 17th month study with continuous monitoring. However, some of the limitations are that there was only 6 patients investigated, and I would really like to see this study done on a greater scale. And I would also like to further research the issue on pediatricians misdiagnosing some of the patients who do not have seizures, but do have GLUT1 deficiency syndrome and could most definitely benefit from the ketogenic diet. And these are my references. Thank you, everyone.